I was very disturbed this week to read a letter from a practice owner published in the Veterinary Times magazine. The letter was in response to a previous letter about, quote, overpriced veterinary treatment and its effect on animal welfare. And it concerned a cat presented with a fractured humerus and which, according to the vet concerned, ideally needed referral to a specialist for treatment. The cat had been seen by a local out-of-hours service the previous night, hospitalised and given pain relief. The cat was subsequently anaesthetised and x-rayed, and the owner was advised that the quoted cost of a surgical repair at a referral practice would be in the order of £3,000 on top of the £850 cost of treatment already incurred. In the event the cat was not insured, the client could not afford or, in quotes, could not justify that expense, and so the letter writer said we amputated the leg as a cheaper option. The letter also referred to another case on the same day in which a Staffy Bull Terrier was presented with a fractured radius and ulna. The dog owners were unable to afford the £3,000 quoted for a surgical repair by a referral practice. The limb was initially stabilised with a splint, but 2 weeks later it had to be amputated. One of the great benefits of working in a primary care practice during my clinical career was the opportunity of looking after most patients throughout the case, from initial consultation, planning and supervising diagnostic procedures and handling whatever surgery was required. At that time, we dealt with a large number of orthopaedic trauma cases resulting from road accidents. We recognised we weren't specialists, but the truth is that the majority of cases required a straightforward surgical repair, and most patients did very well. And because at that time the availability of timely referral services was almost non-existent, we also learned that for those orthopaedic procedures beyond our capabilities, the miraculous value of cage rest and time in some cases achieved a return to almost normal function. So my question is, are too many cases which could be treated successfully by competent clinicians in well-equipped primary care practices being referred? There is surely a case for encouraging more young vets to recognise that they do have the skills to deal with many more cases in-house, and that would go some way to ensure that the cost of such procedures could be maintained at perhaps a more realistic level. See you next time.